talk about cancer of the larynx. So what is the larynx? So what is the job of the larynx? So your larynx is the area where your vocal cords are. So this is called our voice box. So it's responsible for our breathing, but swallowing and talking. So let's think for a second before we dig into it. If we would have cancer where our vocal cords are, how do you expect that your patient would be? All right, so keep that in mind. So let's dig. So this laryngeal cancer, this is a malignant tumor in the larynx. So what are some risk factors? So with cancer, one of the biggest things are our focus as nurses are prevention. So we want to let our patients know what their risk factors are and how to lessen the risk factors, right? So tobacco smoke, alcohol, coal dust, asbestos, ionizing radiation, HPV, GERD, family history of it. So how is it diagnosed? You can get a scope that'll go down and look at the larynx for you, CT, MRI, and a biopsy. So clinical manifestations. So one of the signs is persistent hoarseness. If your patient voice has been hoarse for weeks, has been hoarse for months, that's something you want to look into. A sore throat, dysphagia, they have trouble swallowing. So first of all, we want to remember what the purpose of the larynx is, and that is our vocal cords. It helps with swallowing, talking, and breathing, right? So they may have unintentional weight loss. They could have pain or ringing in the ears, feeling a lump in the throat, and they could be throwing up blood. All right, so it says that patients may present with hoarseness for more than 2 weeks. They have alterations in their voice. They may complain of, like, I used to have a high-pitched voice. Now my voice is so low. They will have shortness of breath. They also will have trouble swallowing. So we want to remember what the function of the larynx is, and then knowing that if we have a disruption in the function of the larynx, then that's where we get our signs and symptoms from. So treatment option, it depends on the size and the extent of the cancer. So you could do surgical interventions, chemo, immunotherapy, radiotherapy, all those things can be done. But the biggest takeaway, I want you guys to be able to recognize when a patient has cancer of the larynx, or what are some risk factors to prevent it. All right, so a patient can also have a laryngectomy, which is removal of the what? The larynx. So think to yourself, what is the job of the larynx, right? So the job of the larynx is breathing, talking, and swallowing. So let me grab my highlighter. Or let me grab my laser. I'll do a laser instead. So when air flows through the nose, right? So it goes down here and it goes into the lung. But let's put the larynx and vocal cords. That's here in purple. So when air comes in, it goes down, it goes through the lungs, and that's how we oxygenate, right? That's how we get oxygen, that's how we breathe in and all that kind of stuff, right? So when we have a laryngectomy, meaning we remove the larynx, we then now have to reroute the way that we breathe. And then we want to start thinking, okay,